One of the major concerns for pregnant women is the possibility of premature birth. It is the most common complication in pregnancies and happens in 10% of all births. A premature birth is one that occurs before 37 weeks, and prevention is an absolute priority in the health care of all pregnant women. Can it be avoided?
Premature births often happen unexpectedly and with no prior warning, whilst in other cases, risk factors can be identified. The most common are twin pregnancies. Most do not last longer than 37 weeks. Checks must therefore be more intense, particularly during the second half of the pregnancy. Genetic predisposition. If a woman has already gone through a premature birth, she is at a greater risk of having another. The frequency of checkups also needs to be intensified in such cases. Certain infections may be associated with premature birth. These include urinary infections, some vaginal infections, and even some mouth infections such as gum disease. Maternal illnesses such as high blood pressure and diabetes can contribute towards premature birth, whether this be unplanned or upon medical advice. Some abnormalities in the fetus are associated with premature birth. Uterine malformation, previous surgery in the uterus, and a short cervix. Last of all, what we call unhealthy lifestyles, physical and psychological stress, toxins such as tobacco, and a poor diet.
What steps can be taken to avoid it?
Should a risk factor associated with premature birth be detected, the frequency with which checkups are carried out needs to be increased. Progressive measuring of the cervix is particularly important since a short cervix is the most precise indication of a premature birth. A team of gynecologists specializing in high-risk pregnancies and with access to appropriate technology is essential in order to be able to provide the most appropriate healthcare in each case. A healthy lifestyle throughout the pregnancy, including avoiding contact with toxins and refraining from drinking alcohol and coffee, and from smoking. Pregnant women should drink plenty of liquids. Women should rest when indicated to do so, and particular attention should be paid to any symptoms that seem unusual: abdominal pain, bleeding, signs of cystitis, etc.
Can the birth be held off?
Nowadays, there are a number of possible strategies when the possibility of a premature birth has been detected. Surgical intervention, such as cerclage, although this is now infrequent. Other, less invasive procedures providing excellent tolerance rates and very good results, such as a vaginal pessary. This is responsible for a 30% reduction in cases of premature birth. The pessary is a small silicone ring which is positioned in the cervix through the vagina and does not require surgery of any kind. Its purpose is to keep the cervix closed and in the correct position. Numerous drugs designed to prevent the early onset of contractions. The most common of these are vaginal progesterone and atosiban, which is administered through an IV line. It is the responsibility of healthcare experts to keep a close eye on the pregnancy and to correctly identify risk factors so that appropriate preventative measures can be taken. Treatment needs to be personalized and checkups need to be arranged depending on each individual case so that the pregnancy goes full term and a healthy child is born.